For joining us. I'm Jennifer Martin over at Shop Local Raleigh, Greater Raleigh Merchants Association. And we are thankful that all of you could join us this morning. And Bridget Blinn Spears is our special guest speaker this morning. And hopefully I say it right. Is it Nexon Pruitt?
That's right.
And she's our expert this morning that's going to talk to us about all things the vaccine, employers, kind of what you need to know, questions you may have. And at the end, we'll have an opportunity for questions. And so if you have any during the webinar, feel free to go ahead and write them in the chat. We'll take note of those and then we'll save those for Bridget when she's done with her presentation. Also, thank you to two of our sponsors this morning. In addition to Bridget's group, we are going to have Will Gaskins of the Downtown Raleigh Alliance and Jeff Murison from Hillsborough Street. So before we introduce Bridget and give her the opportunity to tell us a little bit more about herself, Will, would you tell us a few things about the Downtown Raleigh Alliance?
Thanks. Yeah, Will Gaskins with the Downtown Raleigh Alliance. We're the downtown organization for Raleigh, and we do a range of things from ambassador services downtown to marketing, engagement, and economic development. And we work very closely with small businesses in downtown, both prospective and existing businesses, and offer a number of support programs there. And we're just very thrilled today to be co-sponsoring this program, and excited to be at this point in what has been a very long year, and excited to have the light at the end of the tunnel, be having a lot of these conversations with businesses, both small office employers, about how we return to the workplace safely, and vaccine is absolutely a part of that equation. So we're thrilled to be a part of this and excited to beat this virus. So thank you.
Thanks, Will. Now, Jeff, would you tell us a little bit about Live It Up Hillsborough Street and your role there with Hillsborough, and if you would like to also give us a quick blurb about Blue Ridge?
Sure. Thanks, Jennifer. First of all, thanks for putting this program together. We really appreciate you leading on support for small businesses in our communities. And of course, are happy to be a sponsor and part of the program. Live It Up Hillsborough Street is a community development organization for the Hillsborough Street corridor adjacent to NC State. And the Blue Ridge Corridor Alliance is a similar organization for that area of the city, just sort of west of 440. Basically everything around the Blue Ridge corridor, from the fairgrounds to Rex Hospital and everywhere in between. But much like the Downtown Raleigh Alliance, we do a lot of services and programs to build the community, create economic opportunity, and welcome people to our communities to have a great experience. And we do that in a lot of ways to support our small businesses. And so it's just great to be part of this program today. Thanks for putting it on.
Thank you, everyone. Now we're going to turn it over to Bridget Blinn Spears. Bridget is a very experienced attorney with quite a large resume, and we're excited to have her and her knowledge and her expertise in employment law, but also her knowledge about the vaccine and for what employers need to know. Again, if you have any questions, please don't hesitate to write them in the box. If you'd like to introduce yourself of who's joining us, feel free to write your business. And if you want to link any of your social media credentials or your website, and that way we can kind of hopefully network afterwards. Bridget, we'll turn it over to you.
Great, thank you. I'm excited to be here this morning. I'm going to share my PowerPoint here so that everybody can kind of see some of the keys here. So are you guys seeing? I want to make sure I'm screen sharing the right thing. Are you guys seeing just the PowerPoint slides and not the next slide screen? Okay, good.
You can see it.
Okay, great. So we're going to talk about COVID-19 vaccinations in the workplace. Some of this presentation kind of leverages some of the things we learned in past epidemics and pandemics, like H1N1 and some of the other things, because that's what the government is relying on as we're working through this very new experience of such a kind of all-encompassing pandemic. And so kind of where we're going to focus today is here's kind of a roadmap of where I'm going to go, and then I will watch for your questions too in chat, and we'll be happy to answer them at the end. So we're going to talk about employee morale and privacy. That's kind of the jumping off point, because there's a lot of considerations that employers want to weigh other than just legality. And so we'll talk a little bit about that, and that's the framework that we'll work from. And then we also are going to talk about vaccine mandates. You know, what can you do? What can't you do? What are the pros and cons there? What information can you ask employees about if you're not mandating vaccines? Then what can you ask? What are the incentives and penalties that you might be able to put in place? Do you have to offer paid time off for vaccinations? And then what about employees who want to continue to work from home or work from home as an alternative? So that's kind of the roadmap to where we're going to go. And like I said, I'll be happy to answer questions at the end. This kind of presentation, lawyers always like to give a caveat. This isn't legal advice. It's just, you know, general framework to think about things. So there are lots of these issues that as you work through them, if they come up in your workplace, you may want to seek actual, like, specific to your circumstances legal advice, because these are very complicated, nuanced issues. So the jumping off point here that I want to kind of work from is the concept of can versus should. There's a lot of polarizing political opinions in the world generally right now, but specifically around the vaccine or the vaccines. There's more than one. And there's a lot of misinformation and lack of information that our employees are dealing with. And so we want to make sure that we're really working through, like, where is my workforce at? Is there already discussion about vaccinations going on in your workplace? Are you participating in those discussions? Are you getting good information to your employees and really starting to educate about why people might want to consider the vaccination and get it voluntarily? Because that's really the best case scenario for employers, is for as many of their employees as possible to get the vaccination voluntarily. There's also really rapidly changing science around, you know, what protection does the vaccine provide? Currently, we have good science that says that, you know, once you have had the vaccination for some period of time, you are protected from having COVID-19 disease that is, you know, likely to make you very sick. It's less clear, although we're developing some evidence, whether that those vaccinations can prevent you from transmitting the virus to other people. And so as that science becomes more developed, the guidance around what we can do once we're vaccinated is likely to shift some and change. And so it's important to kind of keep your eye on that. What we talk about today is sort of based on the concept that currently we think getting the vaccination protects the employee themselves, but we don't have solid evidence yet that it protects everybody else, other than it prohibiting the virus from having another place to kind of continue to change and work into new variants that become more complicated. There's also a risk of discrimination claims here. We're going to talk about that in a couple of different ways, but you want to make sure that you're not treating employees differently based on their current vaccination status, especially because there's very clear trends in who's been able to get vaccinations and who hasn't, particularly as it relates to kind of the vaccinations available on the margins. So people who have been able to figure out, oh, this clinic has extra vaccines, or who, you know, being able to get them at the end of the day that way. And so that's definitely the case for people who are sort of in a more upper middle class and sort of socioeconomic status. And so we want to make sure that we're careful right now about not treating people differently because they haven't had the vaccine. And then there's also these considerations around carrot versus stick. So you know, sort of, do we want to provide incentives to people, or do we want to make sure that we're penalizing people who haven't had the vaccination? And we'll talk a little bit about how those things play out. But from a morale standpoint and a human resources standpoint, I'm sure you're all aware, generally it works out better to offer a carrot than it does to offer a stick. You're less likely to see discrimination style claims if you are giving incentives rather than penalizing people who haven't done what you say. And so mandates kind of fall into that penalty or stick department. And so we'll talk a little bit about that, but there, you know, I think the big question around mandates isn't so much, is it legal? We're going to talk about that. Technically it is, but it's very complicated. And you may be able to accomplish the same thing in some better ways, particularly for small businesses. If you don't have that many employees, encouraging everybody to get a vaccine and kind of working through that with individuals is a little easier than it is for large employers. Okay, so there's a little clip I'm going to play here as far as fun ways to encourage vaccination in your workplace. I got to make sure that I'm sharing my audio here. All right, here we go. I don't know if everybody's seen this, but it's cute little Dolly Parton getting her
it's
vaccine.
Me. I'm finally going to get my vaccine. I'm so excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy.
Oops.
Well, hey, it's me. I'm finally going to get my vaccine. I'm so excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy that I'm going to get my Moderna shot today. And I wanted to tell everybody, I think you should get out there and do it too. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. 'Cause once you're dead, then that's a bit too late. I know I'm trying to be funny now, but I'm dead serious about the vaccine. I think we all want to get back to normal, whatever that is, and that would be a great shot in the arm, wouldn't it, if we could get back to that. But anyhow, I just wanted to encourage everybody, because the sooner we get to feeling better, the sooner we are going to get back to being normal. So I just want to say to all of you cowards out there, don't be such a chicken squat. Get out there and get shot. Think you got it?
I got it.
Okay. That didn't hurt. Just stung a little bit, but that was from the alcohol pad, I think.
Yeah.
Right? Hey, I did it. I did it.
All right. So that's Dolly Parton getting her shot. And that's something that just an easy YouTube share that you can get with to use with your employees. Now I'm having trouble getting this to come back up so I can share the next slide here. There we go. So we want to think about, once people have had shots, Dolly Parton put her shot out on the internet as a way to encourage people to get it. But some employees are going to want to be private with that information, whether they have or haven't had that shot. And so this is something you really want to think about. Now, as an employment lawyer, a concept I run into a lot is discussions around HIPAA, which is the law that protects employee health information. So it's important for you as an employer to know HIPAA does not apply to you as an employer. Now, if you're a covered entity like a health plan or a healthcare clearinghouse or a healthcare provider that electronically transmits information, or a business associate of those entities, you are responsible for HIPAA for for the consumers that you're dealing with or the patients that you're dealing with. But even for covered entities, HIPAA doesn't apply to health information that's in employment records. And so we think about all employee health information as HIPAA, but if you go looking for guidance in this area specific to HIPAA, you're going to get different information than you really need, because HIPAA is not what actually calls on employers. It does, however, restrict what covered entities can tell employers without an authorization from the employee. So what that means is you're not going to be able to, for instance, call your insurance company, even if you have an insurance that you're providing through your company as an employer, and ask whether employees have had the vaccine, because the insurer is bound by HIPAA and won't be able to tell you any information without an authorization from the employee. So the next piece that we're going to talk about is under the Americans with Disabilities Act, which isn't intuitive to what we think about when we think about employee privacy, but this does apply more broadly to employers. And so the Americans with Disabilities Act requires employers to keep disability-related information in confidential medical files separate from personnel files. And so it limits disclosure of information to supervisors and managers who need to know about necessary work restrictions or accommodations, to first aid or safety personnel. If you have a disability that might require emergency treatment, a good example of that is like diabetics who might need to have orange juice or sugar if they have some kind of an insulin issue, or government officials who are investigating ADA compliance. So you're allowed to tell the EEOC if they come looking information that's related to their inquiry. Then there's also the Genetic Information Non-Discrimination Act. We call that GINA, and it limits requesting genetic information from employees. This is actually less likely to come up in the vaccine context, but when you're thinking about employee privacy, it's important to kind of have these expectations in the background, because it sets what your employees are going to expect how they're going to expect you to be handling their medical information. So it requires treating genetic information and a confidential medical record in a separate medical file. And the ADA requires separate medical files as well. So you really should have a personnel file and a medical file for employees. And then it also restricts access to that information that's kind of different from ADA restrictions. And it's pretty rare for employers to get genetic information, but just in case you happen to receive it in this context, we want to make sure that you're aware that you need to keep it very, very separate. So with respect to employee privacy about vaccination and other medical information, you want to keep employee medical, disability, and other health information separate from other personnel files. Make sure you obtain written authorization before you disclose any employee health information, and that protects you from any kind of invasion of privacy claim that the employee might otherwise bring. And then otherwise, you want to require a subpoena or a court order before you disclose any employee health information. And so that also is a way to just protect you, that you're acting in a way that you've been legally mandated to, rather than doing something voluntarily in that regard. And then you also want to make sure that you limit disclosure when you're responding to an authorization or a subpoena or court order to what is specifically authorized or required by that authorization or subpoena or court order. Okay, so this is the big ticket item here, what I'm sure you all, the big question you came here to have answered today, which is, can we mandate vaccines? And the short answer is, the bottom line is that you are not required to mandate COVID-19 vaccines, but you are permitted to mandate them with lots of caveats and exceptions. So if you want to mandate vaccines, that's certainly something that you can figure out a way to do. Whether or not it's a good idea is a separate question, and there's a lot of complicated layers to kind of work through here. So we're going to work through those layers. We're going to talk about things that apply first to all employers, the Occupational Health and Safety Act, so that's OSHA. We're going to talk about some tort claims that can come up, workers' compensation, and the Fair Labor Standards Act. Some of these are things that you might not even think about when you think about mandating vaccines, but they definitely add layers of complication. And then we're also going to talk about two laws that apply to employers with 15 or more employees, but also that generally people don't understand that really small businesses don't have these laws that apply to them. And so, generally, if you can figure out a way to stick with compliance, you're better off, because you will not end up sideways with your employees as often. So OSHA, which applies to everybody, is the law that requires employers to provide a safe and healthful workplace free from recognized hazards that are likely to cause death or serious harm. And so that standard applies all the time, not just during a pandemic. And OSHA doesn't have a specific regulation yet on COVID. And I'm not sure we're going to get one, because I think they tend to focus on things that they view as longer term, although certainly this pandemic has been going on for quite a while now. OSHA has provided guidance, though, on COVID-19 prevention programs, including suggestions that employers find a way to make the COVID vaccine available at no cost to all eligible employees. So currently the federal government is doing that. So that makes it easier. And then also not distinguishing between workers who are vaccinated and those who are not. So vaccinated workers need to continue to follow protected measures such as face coverings and social distancing. And that's in part because OSHA is following the trends of the current science, and we don't have the science yet to conclusively show that the vaccine helps to prevent transmission. Although I think this website is a little bit dated, and I think that science, as I'm following the news, is starting to be developed. And so that guidance may change over time. But currently the requirement is that you still continue to have even vaccinated workers wear face coverings and social distancing in the workplace. There's no OSHA guidance, as I said, on mandatory vaccines. But historically, OSHA has permitted but not required mandatory vaccination. So the last time that they handled this specifically was with the H1N1 strain of the flu, which was a pandemic and actually still kind of is circulating. They expect you to do a risk assessment, which is something that OSHA requires in lots of different contexts in the workplace. And so if that's something you haven't already done for your workplace, it's something that you need to do. And they have some guidance on their website about how to do that. They've encouraged healthcare employees to offer the H1N1 vaccine. And so that was specific in that instance to healthcare employers. I think because of the breadth of this pandemic, we're likely at some point to see guidance that encourages all employers to offer the vaccine. But currently we've got availability issues and also just, streamline issues. Everybody who wants the vaccine hasn't been able to have it yet. They definitely did not require employees to take vaccines. Historically, employers were permitted to make that requirement, but then we're going to talk about this in several different laws. Employees who refuse vaccinations because of a reasonable belief they have a medical condition that creates a real danger of serious illness or death could have OSHA whistleblower protection. So if you require a vaccine and the employee believes that the vaccine could hurt them and that belief is reasonable, then they may have some whistleblower protection there because then it's not safe or helpful for them to take the vaccine. So that's the framework specifically under OSHA to think about that through. Again, nothing suggests you have to mandate a vaccine to comply with OSHA. All right, so then looking on to the sort of next layer of complication, we've got tort liability. So the first question that people often ask lawyers is, what is a tort? And so we hear about tort reform and we hear about tort legal cases on the news sometimes. And so it's important, I think, to define it so we all understand what we're looking at here. So a tort is a wrongful act or infringement of a right other than a contract right. So you could also sue under a contract if you had one, leading to civil legal liability. So they're essentially a lot like crimes would be in the criminal realm, torts are in the civil realm. And so they lead to money damages paid from one person to another. So the big area here is probably going to be a claim for something called negligent disease infliction. This is not a tort that's recognized in every state, but it is recognized in North Carolina. There are not decisions out there on COVID-19 yet. It takes a long time for those kinds of cases to make it through the courts. It likely would require that the employer have either actual or constructive knowledge of a COVID-19 infection or of likely infection based on symptoms or known exposure and pending test results, and then continuing to expose people. So this tort actually came out of sexually transmitted disease cases. They're pretty interesting factual scenarios that we read. The early case is a North Carolina Supreme Court case called Crowell versus Crowell. So you can tell it's a divorce case going back all the way to 1920. And the Supreme Court held that a person is liable if he negligently exposes another to a contagious or infectious disease, and upheld a jury verdict against a husband who had infected his wife with an STD. That case law is still good law. In 2011, the North Carolina Court of Appeals reversed dismissal of a claim by a plaintiff who sued his neighbor after the neighbor had an affair with the plaintiff's wife and infected her with a sexually transmitted disease, which she then infected the plaintiff with. And so that tort, developed sort of people passing diseases along knowingly. And so then how does that imply in an employment situation? Well, in 1925, we have a North Carolina Supreme Court case holding a power company liable for transmission of malaria to a group of plaintiffs in Western North Carolina when it failed to mitigate what they called unwholesome, unhealthy, and malarious conditions in its dam construction around Linville Falls. And so the point there is, if you know that there is a danger to your workforce and then you fail to take care of it and allow the disease to spread in the workplace or because of your work, then theoretically there could be some liability there. So that's something to really think about in terms of vaccine mandates, but also are there other ways that you can prevent transmission? And there's lots of things that you all have been already doing, I'm sure, to prevent transmission in the workplace, specifically mask wearing and social distancing. And so those things will continue to be important whether or not you choose to mandate a vaccine. Additionally, you want to think about workers' compensation. Once you require a vaccine, then it becomes part of how employees are required to act in the workplace, which means that you may have some liability for related injuries or illness that you would not have if they were taking the vaccine voluntarily. So you want to make sure that you coordinate with your insurance carriers and weigh that kind of claim as a risk. Now, workers' compensation should protect you in that instance, but you want to make sure that you're on the same page with your insurance carrier about that. And then there's also, if you mandate a vaccine, Fair Labor Standards Act overlay. So the Fair Labor Standards Act governs minimum wage and overtime payments. And it requires you to pay workers for any time that you suffer or permit them to work. It's a really broad definition of work. And so if you require people to get a vaccine as part of their job, then that time for people who are not exempt from the overtime rules is compensable work time. And so if you have a vaccine clinic at work, then that makes it a little easier that people don't have to take as much time off. But if you're requiring people to be vaccinated by a certain time, then you as a best practice, I couldn't hear what you said. Sorry. As a best practice, want to spend time receiving vaccinations. You want to make sure that they are paid for that time, so you don't face some kind of an overtime or minimum wage Fair Labor Standards Act claim there. Okay, so the next kind of big overlay, and this is probably the most complicated one, is the Americans with Disabilities Act. So the big picture for the ADA is that it prohibits discrimination against qualified employees with disabilities, and it permits employers to have what they call a qualification standard. And so that's what, how are you qualified for this position? And the qualification standard can include and should include that an individual does not pose a direct threat to the health or safety of individuals in the workplace. Now, the EEOC, which enforces the Americans with Disabilities Act, has told us that individuals who test positive for COVID-19 constitute a direct threat while they're infected. So you can exclude people who are currently positive for COVID-19 from your workplace without worrying about liability under the Americans with Disabilities Act. But it also requires reasonable accommodation of qualified employees with disabilities unless accommodation would cause an undue hardship. And so this becomes important when you start looking at vaccinations, because some employees may have disabilities that impact their ability to be vaccinated, like allergies or immunodeficiency, those sorts of things. So based on guidance from the CDC and public health authorities as of March 2020, the pandemic meets the direct threat standard. And so there's a significant risk of substantial harm posed by someone having COVID or symptoms. And so for currently, you're allowed to treat people with COVID-19 as a direct threat. Now, that's a different proposition than treating people who have not been vaccinated as a direct threat. And so we need to think that through in a kind of different lens. So if the qualification standard screens out employees with disabilities, then you have to show a direct threat. So if your qualification standard becomes employees have to be vaccinated, and that screens out employees who have disabilities that don't allow them to be vaccinated, then you're going to have to work through this direct threat analysis. And a direct threat is defined under the regulation as a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by a reasonable accommodation. And this is where the rubber kind of meets the road on this, because if we have to show that there's a substantial risk of harm that can't be eliminated or reduced by reasonable accommodation, well, what have we been doing all along before we had vaccines in this pandemic? We've been reducing and eliminating the threat. We've been trying to kind of stop the spread, right? And so there's a few reasonable accommodations that we have already put in place. For some businesses, you've been allowing employees to work from home or requiring employees to work from home. Working from home under the ADA is a reasonable accommodation unless it poses an undue hardship. And it gets harder to show that it's an undue hardship when people have been doing it for months or a year. And then additionally, gloves, masks, social distancing, and other infection control practices like hand washing and disinfection of surfaces overnight, those things are also potentially reasonable accommodations that could be viewed as reducing or eliminating the risk of substantial harm. And so that makes it more difficult to make vaccination a qualification standard because it will be very challenging to meet that direct threat analysis. So what is an undue hardship under the ADA? Well, it's an action that requires significant difficulty or expense. And so there's some factors that the EEOC looks at in terms of what an undue hardship is, the nature and cost of the accommodation, the overall financial resources of the company, and then what type of operation is it? And so here you want to kind of be thinking through, what have you been doing? What were you permitting employees to do to reduce your risk of spreading COVID in your workplace before the vaccine? And were those things effective in reducing or eliminating spread of COVID-19? And if you're a workplace that has had a significant outbreak of COVID-19 despite those kinds of distancing and other measures, then you might have a better argument than an employer that has had fewer at work kind of exposures to people, that those, for whatever reason in your particular workplace, that those measures don't work as well. Okay, so the next layer is religious accommodation. So this is Title VII, which like the ADA only applies to employers who have 15 or more employees, but it prohibits discrimination on the basis of race, color, religion, sex, and national origin. And so it's important to know that you may have employees who refuse vaccinations due to sincerely held religious beliefs or practices. Now, this is different from refusing a vaccine because you don't believe in the science of it or you have some political opposition to it. Those are not protected. But if those things are because of a religious belief or practice, then as employers, you're required to offer a reasonable accommodation unless it would pose an undue hardship. And so under Title VII and religious accommodation, it's actually a much easier standard to meet for undue hardship for employers. So it's defined differently than it is under the Americans with Disabilities Act. So it's really just more than a de minimis cost. So if it's just, de minimis means not very much. It's Latin for just a little bit. And if it requires coworkers to take on additional work or it involves any kind of significant financial outlay, then it's going to be pretty easy to show an undue hardship under Title VII. Okay, so what about vaccine information? So if you don't choose to require your employees to have a vaccine, then what can you ask about? Like, can you even find out if your employees have been vaccinated? And the answer to that is yes. So the big question there would be, is this a disability related inquiry that would be subject to some restrictions that the Americans with Disabilities Act places on this kind of inquiry? And the EEOC says that it's not. So if you're going to require proof of a vaccine, then you want to warn employees, though, not to provide any other medical information other than whether they've been vaccinated. If you ask a bunch of follow-up questions, or really any follow-up questions, like if they haven't been vaccinated, why not? Then you could be kind of veering into this disability-related standard. In order to ask disability-related questions, you have to meet the standard that those questions are job-related and consistent with business necessity. And that's where, if you want to ask those kinds of questions, I would suggest that you seek some legal advice specific to the particular circumstances involved, because that can get very complicated, and it's a very nuanced and fact-specific inquiry. And then again, you want to keep any records that you receive about vaccination separate from the personnel file. So you should have a separate medical file for people, and that's where vaccine-related records should go. You want to keep those records confidential and separate, where they're only available on a need-to-know basis to people. Okay, so what about incentives or penalties? This works a lot like mandates, except that it is sort of the carrot versus the stick. Lots of employers are offering incentives to encourage employee vaccinations. Some of the things that folks are trying are cash bonuses, paid time off, extra vacation time. Some employers are offering essentially like they're paying for people to go get the time that they're going to get the vaccine, and then an equal amount of time they're providing as additional paid time off or extra vacation time. And then they're also offering paid sick time for side effect related absences. And so most people who are receiving these vaccines don't have significant side effects, but there are definitely people who are, laid up for a day or two and kind of feel like they have the flu, or otherwise really tired and it would be hard to work. And so that's important to plan for. If you're encouraging people to go get vaccines, you want to make sure that they understand they're not going to lose paid time. There's a lack of guidance from the EEOC around whether or not this is okay to do. There was some de minimis guidance that you could really only offer incentives that were just, again, considered very little. But that guidance has been withdrawn with the change of administration. We anticipate that we may get more guidance at some point, but we don't have it yet. And so we're kind of looking to what has been okay historically. Again, there's a risk of discrimination claims here that there could be disability and religious accommodation issues, just like this. It's the same issue as with mandates. And so if you're going to handle this through incentives, you need to make sure that you have a mechanism for people who have a disability or a religious objection to receiving the vaccine to access that same incentive in some other way. And so that's something, again, that you may need to structure with some help from somebody, again, specific to your particular circumstances. And then if you're going to actually penalize employees, like they're not allowed to come to a certain employee event, or not able to go on trips, those sorts of things, that's subject to a similar analysis. But again, penalizing employees has a higher morale impact, and therefore is a greater risk for discrimination kinds of situations. And again, even if you penalize employees, you aren't going to be able to penalize people who have disability or religious related reasons that they're not receiving the vaccine. Okay, what about paid time off? Do you have to give paid time off for people to go get their vaccinations? And the answer is no, but if you can, you should. So there is no North Carolina or federal law requiring PTO or sick or vacation pay. If you offer PTO or sick or vacation pay, your policy governs. So if your policy says people have to give you a certain amount of notice before they can take PTO or sick time or vacation time, then your policy will govern how this works for these vaccinations as well. But you could also write a specific policy for vaccinations. For example, there are clinics in sort of around the triangle where people have had extra vaccines at the end of the day. And so if you hear about one of those and you have the ability to run down and get one, then even if your sort of group isn't open yet, that's an option that's open. Well, that would require some real flexibility in the workplace in order to let people access that. And that may not be practical for everybody. And then there's also the Families First Coronavirus Response Act, which applied to employers who have fewer than 500 employees. Now, most of that expired at the end of last year. It mandated emergency sick pay and expanded family and medical leave for employees. And it also permitted tax credits to offset those costs for employers. So that Families First Coronavirus Response Act tax credit has been extended, but the paid components of it are not mandated. So if you choose to continue to provide the paid leave that it offered, then you can take the tax credit for it, but it's no longer mandated. So there was a Consolidated Appropriations Act that extended it through March 31st of this year. And then the America Rescue Plan of 2021, which just sent out its next stimulus checks, I think this week or last week, has extended this benefit through September 30th of 2021. So under these extensions of the FFCRA, employers are allowed to voluntarily provide qualified sick leave or paid family medical leave and continue to receive a tax credit. So what is qualified sick leave under this law? Well, there's some new qualifying reasons as of April 1st. And actually, as of April 1st, if you had already provided COVID-related emergency sick pay last year, you can restart the clock for employees who had it last year. So effective April 1st, they could have a new bank, kind of like family and medical leave works. So you now can pay people and get a tax credit if they're obtaining the immunization. So if you provide PTO, you can get a tax credit for that. For recovering from injury, disability, illness, or other conditions related to the vaccine, or for people seeking or awaiting results of a COVID-19 test because of exposure or because the employer required it. So the FFCRA already covered employees who were unable to work or telework because they were under a government quarantine or isolation order. They'd been advised by a doctor to self-quarantine because of COVID. They were experiencing symptoms or seeking medical diagnosis. So last year, you were required to provide emergency sick leave, pay of up to 2 weeks for this. Or caring for an individual subject to quarantine or isolation order, or advised to self-quarantine because of COVID-19. And then additionally, there's this bullet about needing to care for a child because daycare or school is closed and childcare is unavailable due to COVID-19 precautions. And so that's actually an extension of the Family and Medical Leave Act that applies even to employers who have fewer than 50 employees. And it's a much more extended bank. It's up to 10 weeks. And is a lower payment. And so if you're considering doing that, then you want to look for guidance on what the pay limits were under the FFCRA. It's up to $511 for these first 4 bullets. And then this 5th bullet, it's up to $200 a day. Okay, so what about work from home? So work from home can be a reasonable accommodation under the ADA, even if you otherwise prohibit work from home, as long as people can actually do their essential functions of their job. And so, if you're a retail salesperson, you can't work from home. But if you're an accountant for a retail business, you might be able to. And so it's determination on a case-by-case basis through an interactive process that's required by the Americans with Disabilities Act. And you can request reasonable documentation of disability and of limitations. And so that's something that's a process you want to work through consistently with each employee who requests this, and you can't handle it with a blanket rule. So you also want to assess whether essential functions can be performed at home. That's something you need to do, again, on a case-by-case basis. And the employer's preference and the employee's preference is not a factor. So the fact that you really want people to be at work that you value face time, that's not really a factor in essential function analysis or in reasonable accommodation analysis, unless it somehow could fit into the undue hardship. And that would be a case-by-case situation. Okay, so let's think about your essential workers vaccine toolkit that the CDC has offered to you. And so these are free resources that the government has already put together. And so there are ways to encourage employees to receive the vaccine. There's templates for emails, there's letters, there's flyers, all ways to kind of encourage your employees to go get that vaccine. They have posters and fact sheets, options to add your own logo, really ways to get kind of an information campaign going, and even printable stickers for vaccine recipients. There's social media graphics, they have template messaging, all in the service of kind of encouraging employees to go do this voluntarily, which avoids a bunch of the legal overlay and challenges that come with mandating a vaccine. The CDC encourages employers to offer vaccination at no charge during work hours if you can. So if you want to hold a vaccine clinic like that, you can contact your local health department. They can work that through. If you're too small an employer to really be able to put that together on your own, you might consider, can you get a group together of other small businesses and do it together? The CDC is encouraging, again, allowing paid leave for vaccinations that are already available to people, and educating employees with the posters and offering with locations. So helping people figure out, where can I get vaccinated, including articles about the importance of vaccination and locations where vaccines can be offered. They also have some resources specific to hosting a clinic that includes a checklist for best practices and some FAQs and principles for holding safe vaccination clinics if you decide to go that route. And then there's also a law that specifically may apply to provide some immunity from liability, other than for willful misconduct, related to claims around offering this kind of a vaccination clinic. All right, so what is the Department of Health and Human Services saying? So it's provided some interim essential industry employer guidance that suggests that employers should be providing vaccination information. And if you have employees who don't speak English as a first language, then you should provide it in their native language. There's some presentations available through the Department of Health and Human Services on their website They are encouraging reminders and assistance with things like scheduling and transportation to vaccination sites that can be challenging for some employees. And they're suggesting helping to coordinate staggering scheduled vaccinations so you avoid people experiencing temporary reactions or side effects simultaneously, because that could be really disruptive to your workforce. The North Carolina Department of Health and Human Services also offers a list of resources to share with your employees about the COVID-19 vaccine. They have template communications for employees about the vaccine. And there's additional information from the CDC, again, about staggering when employees are vaccinated that can help. And there's also some steps for coordinating with local vaccine providers. So those are all in the service of encouraging employees to go ahead and get vaccinated without actually requiring it. So that's kind of the overlay. I know it's a whole lot of information all at once here. And so I want to, let's see, I'm going to stop screen sharing here and we can go back and I can answer any questions that you all have. And so I'm looking to see, I don't see any in the Q&A here, and I'm looking to see in the chat. If people have questions and they want to pop them up here, I'm happy to answer them.
Bridget, I've also got two. First of all,
Okay.
thank you. That was absolutely incredible information. There's so much to take in. I feel like I need to watch it a second time to fully grasp it all. One question that did come in was, employers can require proof of vaccine only if they have a vaccination policy, or open knowledge they can ask their employees if they've been vaccinated.
You can ask employees if they've been vaccinated. You want to be careful if you're going to do that. The reason you would want a policy is to kind of govern and guide how you're going to do that so that you are consistent. Because anytime you sort of start randomly treating some employees differently than others, you run the risk of a discrimination claim. So it would be a best practice to put a policy in place and then to follow the policy with respect to how you're going to ask the information and how you're going to keep track of it. And then you also need to make sure that you're currently, because of the OSHA guidance, not treating people differently if they've been vaccinated or they haven't.
So even if you don't have a vaccination policy, you can ask employees if they've been vaccinated or not.
You can. And then you just need to, if you're going to write that down, you need to keep it separate from your other personnel files.
Another question that came in, if anyone else has questions, please feel free to type them, or you can send them direct to me and I'll read them just as I am if you don't want to put it publicly. Can employers require people to come back to work if the employee doesn't know if all other employees have been vaccinated? Meaning, if the employee is uncomfortable not knowing if their coworkers have been vaccinated, can the employer require them to come back to work?
So the answer is yes, but so it depends on why they're uncomfortable. So if they're saying they need to work from home because they have some kind of a disability that makes them more susceptible to COVID, or where they would be at higher risk if they contracted COVID, then you're certainly not going to be providing information about who all's been vaccinated to your workforce. So that's private health information that you can't be sharing. And so really employees who have disabilities that are COVID related, until they're vaccinated themselves, you need to work through that on that individual interactive process basis through the Americans with Disabilities Act coverage, unless you have fewer than 15 employees, in which case you can require them to come back to work. And if they can't, then they don't have that claim against you because you're not covered by that law.
Really good questions. What are some of the most common questions you're getting from clients about the vaccine? Like, what are you hearing the most?
So a lot of it is structuring incentive programs, can we mandate, should we mandate, really working through, like, it depends on the industry that employers are in and sort of how effective things have been. Some people have had really different experiences. I've definitely dealt with clients who had challenges with mask compliance and then had outbreaks, and sometimes as many as like 10 or 15 people in really small businesses that only have like 20 or 30 employees, and half their workforce is out all at once because people went out to lunch and hung out too close together, that sort of thing. And so they want to prevent that from happening again. And so the people who've had that experience are much more interested in really thoroughly exploring what a mandate would look like and how you would handle exceptions to a mandate, that sort of thing. And then I think the other is like the whys around If people have been vaccinated and the vaccine's so great, then why do we have to treat people the same if they've been vaccinated or not vaccinated? And again, that's really, I think we're just waiting for the science to show that transmission is different. And then we're also going to have to navigate the employee privacy issues around, if you're requiring people who haven't been vaccinated to wear a mask and not requiring people who have been vaccinated to wear a mask, you're essentially publicly advertising who has been vaccinated and who has not. And so that's something you really need to think through. And I think we will need some clear guidance on before we start saying that anybody cannot wear masks in the workplace.
Yeah. Those are really interesting and helpful. And I guess too, I would also wonder from an employee standpoint, with these that have larger than 15, if they required everyone to get vaccinated and then they got sick, or had some complications, it sounds like you also have to have a plan in place for that as well.
Yeah, your workers' comp should carry that, should cover it. And it's just the kind of thing that you would want to talk through with your carrier so you're sure that they don't have some out, that they are going to point to some part of your policy to say, oh, no, this isn't covered because you want to cover that with them from the beginning.
So
there's a claim.
You recommend employers contacting their insurance agent now to make sure that their workman's comp policy is covering them.
If you're going to mandate the vaccine, yeah, I would work through that with your carrier before you do it. Because the other thing about mandating vaccines right this minute is it's a timing issue, right? Like you can say everybody has to get a vaccine, but not everybody's eligible yet. And there aren't vaccines available for everybody who will someday be eligible. And so some of these mandate concepts are forward looking to at least a few months from now, when there are actually enough vaccines for everybody who wants one.
Okay, I've got another question that came in, and I apologize for the train in the background.
No problem.
Here. If you have essential work in the office and workers in the office, they refuse to be vaccinated, how does that impact when other employees come back into the office?
So it shouldn't impact too much because you should be still doing masks and social distancing. And your employees shouldn't know unless they choose to share with each other whether they've been vaccinated or not. So really, for right now, the best practices around employer or employee space is that you still want to have masks and social distancing. And so you can require people to come back to the office. That's been the case for a while now, as long as you can fit within the restrictions. I think the current governor's order says no more than 50 people in a large gathering. And so you want to keep an eye on those things. You don't want to be having 100 people at an all employee meeting or that sort of thing. But otherwise, have people, make sure people are wearing their masks and make sure that that's the culture that people, and they're wearing them over their mouth and their nose and staying 6 feet apart. And that really should be sufficient. That's been sufficient in most workplaces and in schools to keep people from transmitting COVID in their workplaces.
I had another one that came in. What is a reasonable amount of time off for employers to give to employees to receive the vaccination?
It depends on where they're getting it. And so I, for instance, literally got a text from a friend who was like, hey, they have extra doses in Harnett County. And so I drove down to Dunn on an afternoon. Well, I live in Raleigh, so that's, an hour plus round trip. And we didn't jump the line. We got there and we said, hey, we're just here if there's extras. We are not, our group isn't open yet. And they were like, yep, come on, we've got plenty. And so if you have not been vaccinated and want to be, I would keep an eye out for those open clinics and ask that way. But that took a half day. Whereas if I had been in line, for a vaccine here in Raleigh, for one thing, I wouldn't be vaccinated yet, but also it would take a lot less time because of the travel time. And then another incentive that I didn't mention in the presentation that employers are sometimes offering is mileage. So that if people find an appointment far and choose to go get one, that their employer would cover their mileage.
And in addition to the time off to go get the vaccine, let's say an employee does have some sort of reaction. What is a reasonable amount of time to give them, after they've received the vaccine? Should they have, and do they need to supply the employer any type of information or proof that they've had some complications or reactions?
So at least based on what I've seen, unless you have a really severe reaction that puts you in the hospital, it's not the kind of thing you go to the doctor for, right? Like you just feel crummy for a few days. And And so it's the kind of thing where as long as it's only a day or two, I would say trust your employees that, unless you have somebody, and frankly, even if you have somebody you're not quite sure whether they're abusing sick time on a regular basis, this is just not an area. This is kind of a one-time deal. So I would give people a pass and be pretty liberal with letting them take time off if they don't feel well after a vaccine.
Okay, another question. Do you recommend having an attorney on retainer? And so that if they should have questions related to the vaccine and policies, they can call, or what do you recommend for next steps for employers?
Well, I of course recommend everyone put me on retainer. I'm just kidding. So you don't necessarily need to have a lawyer on retainer. So a retainer works that you pay kind of regularly for access, for advice, whether you need it or not. The best thing to do is to develop a relationship with an attorney where you get some help with putting your policy in place, and then they understand your policy and your workforce, so then they can answer the phone and just bill you by an hour by the hour to talk about whatever issues come up. And so that's how I've been handling it with most of my my clients. And it's an interesting area because there's so many specifics to your workforce or to your particular existing PTO policy, or your just the way that your employees view the world politically. Like there's just a lot of layers that inform the best way to handle this in each individual workplace. So I do suggest working it through with a lawyer. I'm always happy to do that for people that need it. And I know there's other attorneys in town that are also ramped up on these things and happy to help as well.
Do you recommend having a policy one way or the other in writing, whether it's you're mandating the vaccine or not?
If you're mandating the vaccine, yes. If you're not mandating the vaccine and you're just encouraging it, and if you're going to put incentives in place like PTO or those sorts of things, then yes. If you're just going to sort of encourage people to get the vaccine and kind of flexibly work through it with people, you don't necessarily need to, but then you may not have as much, sort of as many people vaccinated as quickly as they might be otherwise.
That's the majority of the questions. I think I've got everything answered here. Will and Jeff, did you guys, either of you, get any questions in that you'd like to ask? Or if you're participating, feel free to raise your hand if you'd like to ask a question, or you can enter it in the Q&A box as well. I want to make sure we didn't miss anything. Bridget, this is excellent information. We will be obviously making this webinar available. It's being recorded. It'll be shared later. What other places besides going to your website should people look to seek if they have questions?
So our website's a good one. My contact information is available on our website as well. And then there's also all of those agencies that I mentioned, the OSHA, the EEOC, the CDC, North Carolina Department of Health and Human Services, all of them have lots and lots of information available, and you can kind of fall down a rabbit hole almost indefinitely following it. But I'm following it already. And so I'm happy to help people navigate that if they have specific questions.
Here's another good one. Not knowing a lot of the science right now and how long the vaccination will potentially last, will employers have to potentially look to annually offer a time allowance for employees to go and receive their vaccination?
So if you are just requiring it now or offering it now doesn't mean you're locked in to offering it indefinitely. And so I would say you could make it a 2021 policy and then reconsider it in 2022. I don't think there's an indication that we're going to need more than one vaccine in a year. And so, and again, yeah, they're right. That science is still evolving. It may work out to be like the flu shot, where we kind of get it every year for a while.
Well, Bridget, I can't thank you enough. I think this was wonderful information. Solido, obviously, too, is our partner in this for technology. We want to thank them for the use of their platform and allowing us to use their webinar function, being that they are a local web provider and IT internet support system. If any small businesses need help with getting their internet off the ground or high-speed fiber, contact Solido. Bridget, again, if you would give us, if you would just real quick type in the chat, if you would, your contact email. We can share that with if anybody has questions as well, but I want to make sure that you do have her information should you need it or have questions for follow-up and want to reach out. Downtown Raleigh Alliance and Hillsborough Street, Live It Up Hillsborough Street. Thank you both so much for helping sponsoring as well and making this possible so that we can share it with as many small businesses and employers throughout the triangle here that we can get their information out. So thank you everyone for joining us this morning. If you have any follow-up questions, Bridget's information is in the chat there, and we would like to thank you all for joining us. So
Thank
thank
you.
you.
Bye, y'all.